Nothing boils my blood more than how our system expects providers to prescribe high blood pressure medication. You've never heard this before because no one is talking about it.
Well, today we are talking about it. We're going to take a closer look at healthcare inequities in the U.S. Our current medical system recommends that physicians follow different protocols to treat high blood pressure depending on a patient's race.
And as things stand right now, Black patients can be treated for hypertension with one of two classes of medications, but non-Black patients can actually be prescribed any medication the doctor sees fit without restriction. So urgent care medical director Dr. Bayo Curry-Winchell joins us now. Dr. BCW, this is fascinating, and I'm glad that we're talking about this. Why? Why do Black patients only get two options when everybody else gets, any of them, all of them?
Well, it's based on this notion that Black individuals should be treated differently. And they're really looking at just the color of our skin, which is not genetic, it's not ancestry. And we know that in America, we are a blend of different diversities. So why should one group be treated based on the color of their skin? This is harmful, and it limits access just based on what you look like.
But you're saying there really is no
genetic medical basis.
That is correct. Clinical studies have shown this shows no benefit. If anything, it's harmful because you are giving medicine based on what someone looks like versus the individual needs, based on their lifestyle, other factors. You are making a decision based on what you see in front of you.
So if you are a Black patient with high blood pressure and you go into your doctor and they only offer you these two options, do you say, no, I want the whole slate of options? I mean, is there an insurance restriction? You're saying there's no medical basis for it, right?
I am. There's no medical basis. So if you are a Black individual, I am encouraging everyone to ask your clinician, are these all of the medications I could have? Are there other choices? Because you have the right to have the right medicine, as well as know that there are many options beyond just two classes of medication. So there's two calcium channel blockers and thiazide that are recommended based on the color of your skin versus all of the other medicines. And the other piece that we can't forget, Black individuals are dying at the highest rate for what? Uncontrolled high blood pressure, which can lead to kidney failure. And at this point, we're 7 to 8% risk factor for developing kidney disease. So it's a full circle when we look at how this adds to the inequities and disparities that we see for Black individuals.
And when you talk about the complications that can arise down the line, what are the long-term risks of either having those symptoms or not treating those symptoms?
So as you mentioned, let's break it down. You come in and you have high blood pressure. You're given a medication based on the color of your skin. Now your blood pressure isn't controlled. Unfortunately, you're developing kidney disease, kidney failure. Then you may end up needing a kidney transplant. So this is full circle. This complication can lead to a shortening of your life based on the fact that this notion that you should only have two classes of medication.
So you mentioned talking to your doctor and saying, are these all the available options to me? What else can patients do to advocate for themselves?
So really thinking about having someone with you that can advocate, ask questions. I encourage everyone to say, are these all of the medications that I can have? And also, what medicines did you not consider? Because I think that's something we don't think about. Ask the clinician, what did you rule in and what did you rule out as far as medicines? And last but not least, a second opinion is so vital. Do not take that one answer as the ultimate answer. You have the right to have care delivered based on your needs. And asking and advocating is so important.
Right.
Yeah, I mean, I think I can't sort of even engage in the idea of having to have a non-Black advocate with you for your health care. I mean, that is just that we cannot be in a place in this country where that would even be something on our list of requirements. What is the medical community as a whole doing to address a treatment gap that you as a doctor know exists? You as a doctor have identified that we're not talking about. What are people doing about it?
So for me, it's all about raising awareness, but also having those conversations and really disrupting this notion that this is the way care should be. And to your point, no, you may not be able to have a Black or non-Black person with you, but what you can do is have this knowledge each time you go into the clinician and ask, Is this all of the options? Why did you make
What
that
else you got?
decision?
Yeah.
Yes.
And before you go, doctor, what's the origin story here? Were there studies in the beginning that said this was a better way to treat black patients? Or, I mean, where did this come
Or is it
from,
based
this
on
notion?
medical assumption and not medical fact?
It's a blend of both. So clinical trials, which we know are really helpful with certain studies and certain treatments. However, unfortunately for black individuals, this thought that race identified the same thing as ancestry and genetics, and then
No, that's not
incorporated.
true.
It's not true.
Right, Dr. Bayo Curry-Winchell,
Yes.
thank you so much. We
Thank
appreciate
you very much. Information we need and can use.